Hello listeners. I will be talking on problems in social stigma and illness behavior across culture. One problem in this aspect is stigma, discrimination and HIV. What is stigma, discrimination? Stigma is the shame or disgrace attached to something regarded as socially unacceptable. Discrimination means treating one person differently from another in a way that is unfair. For example, treating one person less favorably simply because he or she has HIV. While stigma is sometimes hard to pin down, it may be found in people's attitudes or beliefs. Discrimination is a little easier to describe. It's about actual behavior. HIV is an infection which many people have fears, prejudices or negative attitudes about. Subsequent researchers have viewed this more as a social process that creates or perpetuates social inequities and which is used to legitimize discrimination. While this is generally true, stigma can also be a primal human response, particularly in the case of fearing a disease that is transmissible and potentially incurable. There are several forms of HIV stigma and discrimination. Self-stigma or internalized stigma. Governmental stigma. Healthcare stigma. Employment stigma. And community household level stigma. Ever since the first cases of AIDS in the early 1980s, people with HIV have been stigmatized. There are a number of reasons for this. HIV and AIDS are always associated with death. HIV is associated with behaviors that some people disapprove of, like homosexuality, drug use, sex work or infidelity. HIV is only transmitted through sex, which is a taboo subject in some cultures. HIV infection is the result of personal irresponsibility or moral fault such as infidelity that deserves to be punished. Inaccurate information about how HIV is transmitted, creating irrational behavior and misperceptions of personal risk challenges. Research by the International Center for Research on Women, ICRW, found the possible consequences of HIV-related stigma to be loss of income and livelihood, loss of marriage and childbearing options, poor care within the health sector, withdrawal of caregiving in the home, loss of hope and feelings of worthlessness, loss of reputation. HIV-related stigma and discrimination refers to prejudice, negative attitudes and abuse directed at people living with HIV and AIDS. In 35% of countries with available data, over 50% of men and women report having discriminatory attitudes towards people living with HIV. The consequences of stigma and discrimination are wide-ranging. Some people are shunned by family, peers and the wider community, while others face poor treatment in healthcare and educational settings, erosion of their own rights, and psychological damage. These all limit access to HIV testing, treatment and other HIV services. The people living with HIV stigma index indicates that roughly 1 in every 8 people living with HIV is being denied health services because of stigma and discrimination. Thank you.